you do this so powerfully because of the reach of your intellect and learning. But it's a very interesting crossover here because I imagine you would not self-identify as a conservative, and yet it was Edmund Burke who said that I think that life is a contract between the dead, the living, and the future, and we've stripped that out. We seem to be insistent that no one who's gone before us had any wisdom at all, and in this country it extends to universities vigorously resisting the teaching of Western civilization because of its failings. Now, it wasn't perfect, but surely in studying the successes as well as the failings, or the other way around, the failings as well as the successes, you maximise the chances of finding a good way through. No, it has to be denied in order that people can be putty, if you like, in the technocrats in the hands of the expertocracy, the very point that William Thomas was making. We can establish any attitudes and values we want.
Yeah, I mean, I think this is really important because you don't need to be an old school conservative to understand the importance of conserving cultural traditions, of conserving a legacy that is the product of centuries of human experimentation, of human sacrifice. They are the most valuable resources that we have, no matter what your political beliefs are, in making your way in the world. You can't create or build anything of value just by starting from scratch. You get up in the morning and you forget that there was a human past. You can't simply just start anew with nothing in your head. I mean, that doesn't make very much sense at all. And it seems to me that if we stop taking seriously what we learned through the centuries, then we're left with very little in terms of understanding our own predicament. So in that sense, I think what's really what we're really talking about here, this is something that the practitioners of this brutal process of making fun of the past don't understand, is that if you actually carry through that kind of process, you end up being prisoners of the present. It's a kind of presentism.
Yeah.
You're kind of cut off from everything that kind of preceded you. But because you've been cut off from everything that preceded you, you haven't got the capacity to move forward in the future. You haven't got the resources, the moral and the intellectual resources to move confidently into the future. And therefore, you kind of stay in the present in a kind of state of stasis and cultural paralysis. And that's really what we're seeing today. And when earlier on you talked about how people are so volatile in terms of the way that ideas change, what we are really talking about is people who are, in a sense, jumping around within the same presentist space, trying to somehow find some meaning. But you can't really do that unless you have your eyes are both to the past and towards the future. That's what makes us really an exciting species as human beings, that we have a sense of history, a sense of movement, and a capacity to understand that we came from somewhere, but we're also going somewhere a little bit different.
And it seems to me, just building on that, I found this part in your book, 100-page 185, particularly intriguing. You said, decades before the word snowflake, and our listeners and viewers will know what that word means, began to convey the connotation of fragility and vulnerability of our young, it was evident to some prescient observers that techniques of validation encouraged sections of young people to become inward-looking, powerless and confused about their identity. It really struck me that. You're getting all these paradoxes. We talk about making our children more resilient. They're less resilient than ever. Are you arguing, it seems to me, if I can pick this point up, that paradoxically, the more we sort of massage our children's egos with the thing that you were talking about earlier, making them feel good about themselves, the more fragile their actual self-esteem will be, the less resilient, the less outward-looking and if you like, positive they actually are becoming.
Well, look, you don't need to have a PhD in psychology to understand that the more investments we make, in mental health resources, and the more psychological interventions we make in education over the decades, the more the mental health crisis, as it's called, gets greater and greater. So it's interesting, and it's almost paradoxical that it's not noticed, that despite greater and greater investment in psychological intervention. Psychological problems seems to increase year on year. And in Australia, as much as in England, you'll find that every month almost, you get a new report that says the mental health crisis amongst children is increasing. You had this massive reports during the pandemic, a lockdown. Children's mental health is a far bigger problem today than it was last year. And if you go back over the last 30 years, you'll find that every year the same reports come out. You never get a report that says the mental health state of our children has improved. The mental health of Australia is far better than it was 5 or 10 years ago. You never get that. What you get is that the continuous downbeat, pessimistic assessment of things that are getting worse and worse. And I think there's a correlation between the apparent decline in well-being and mental health, the increase of different kind of psychological conditions, and the framing of everyday life in a psychological language. If we introduce psychology as the main medium through which people are forced to interpret their experience, if we then tell them that psychological problems are very real and are likely to affect them, if we also tell them that if you have a psychological issue, you're going to be damaged for life, you're going to be traumatized for life, then it's inevitable that people will be dispossessed of their capacity for resilience. They will be dispossessed of their capacity for autonomy and independence, and instead they will feel powerless. So I'm not at all surprised that there's a close correlation between the expansion of psychology and interest in providing resources for mental health and the intensification of mental health problems.
Makes sense to me, I have to say, but that doesn't make it any less worrying. Can I ask you, the role the universities have played in the rise of a society in which democracy seems somehow increasingly subordinated to a technocracy or an expertocracy that seems to want to reduce many really complex issues. The last time you and I spoke, we talked about freedoms, freedom of conscience, freedom of belief, freedom to act in accordance with your conscience, freedom of religion. But now we have responses to COVID, all these new claims about gender identity, they're all being somehow, it seems to me, dissolved into medical or health issues as part of this. You have to feel good about yourself, even as we feel less good about ourselves.
Yes, I mean, I think what you're describing is the medicalization of everyday life. So basically, what has happened is that ordinary, normal problems that you and I have in the course of making our way in the world, the kind of pain and distress and disappointment that we sometimes feel by being rejected or by failing, which is part of the human conditions, have been recast in a psychological language. So for every existential problem, you now have a psychological diagnosis. So as a result of that, if you go into a room and you feel uncomfortable, but shy, you're not shy, you got social phobia. And if you, for some reason, sort of feel a little bit uncomfortable about leaving home, during the COVID crisis, then you got this re-entry, what they call re-entry syndrome that you're suffering from. And all that it is just a bit wary of doing something that you haven't done for a while. So when you have the reinterpretation of ordinary, normal existential problems in a medical vocabulary, then you're almost incited to feel weak, fragile. You're almost incited to feel sick as a result of that. And I think that this is a very big problem because it both makes us feel weak, but also it distracts us from understanding, sort of what are the moral values, what are the values that we want to live by. It's in the book I call this a crisis of normativity, where basically philosophical and moral norms, which are central for giving us directions, are replaced by medical categories and psychological diagnosis.
Did you enjoy this episode? We cannot get good public policy out of a bad debate. If you value vital conversations like this one, please like, share, subscribe, and join the conversation.